everybody. Good morning. What a gorgeous morning. Yes? Oh my gosh. So thanks for spending this hour with me rather than being outside in the glorious weather because it's so gorgeous out. Yay. So today I get to talk to you about thyroid drugs. How cool is that? So the thyroid, which I think is one of the coolest organs in the body, is going to be, you're going to see a lot of diseases of the thyroid. And so today what we're going to do is talk a little bit about some of the drugs that you're going to use. And the outline is going to be the same that I've done. We just do a little tiny bit of physiology. Sorry, but just to sort of focus in on some of the important physiological points of the thyroid so we can see like what our targets might be for drugs that may work to either enhance our thyroid activity or to decrease it. We're going to talk about the thyroid hormones themselves. We're going to talk about the drugs that we're actually going to use to help manage thyroid diseases, and then some clinical cases to hopefully bring it home a little bit more for you. Any questions from the other lectures that we had? Okay, perfect. So we will start and get done early so we can go outside for a little while. It's so, oh my gosh, it's so gorgeous. I felt like a human being. I think today was the first day that I felt like a human being actually running. Like, you know, you can actually move and not sweat and die. I could take my dog because it wasn't too hot for him. I opened up all the windows in the house, and my husband's like all sleeping and all nice and warm, so I ripped the covers off of him so he can enjoy the nice morning. So he's a very tolerant man. Okay. So why do you need to know? Why do you need to know about thyroid stuff? Okay, you need to know about this because you're going to see a lot of thyroid diseases, especially in small animal practice. We see a lot of hyperthyroid cats. We see a lot of hypothyroid dogs. You will see this in horses. Rarely, I'm told. I, of course, have never seen it, so for me, it's a total zebra. But if I were an equine practitioner, apparently I would see it rarely, but it does happen in some horses. But the cool thing about this, as with a lot of endocrine diseases, is these are treatable. So we have a lot of really good ways to treat them. So again, everyone tells you, oh my gosh, what I'm telling you is the most important thing. And of course, what I personally am telling you is the most important thing. But these really are drugs that you will use a lot. Okay, so I'm going to remind you a little bit about the thyroid physiology because I can't help it because it's so cool. So I just love the thyroid gland because it is like a very, you know, you have to love most endocrine glands because they're really efficient, except for the pancreas. Like pancreatic beta cells suck. I mean, they're really pretty sucky endocrine cells, but most of the rest of them are pretty cool and they're very efficient. And we talked a lot about how the adrenal cortex synthesizes hormones from this common cholesterol precursor that then all you have to do is get in the right layer and see the right enzymes and you get converted into a mature hormone, which is really cool. So the thyroid does it a little bit differently, but it is just as elegant. So the thyroid follicle here, and I know this is probably bringing back bad memories from physiology last year, although I'm sure Dr. Bugby's lectures were amazing because he's so amazing. But the follicle here is the sort of the unit for the endocrine thyroid. And these cells here, the follicular cells, we're going to be looking at them in some cartoon versions, are the cells that actually synthesize the hormone. But the really cool thing about this is that the follicle here, all the stuff you need, all the precursors you need to make mature thyroid hormones sit in that colloid. And every time you need thyroid hormones, your follicular cell just grabs a little bit of it, brings it in, processes it in some lysosomes, and then spits it out. I mean, how cool is that? The way that really helps us in terms of us, because thyroid hormones are like one of the main hormones to regulate your body, right? And you do not want to run out of it. So we have a huge reserve of thyroid hormone that we can have access to even if we don't have the dietary iodide that we need to make it, because it's sitting, a lot of the precursors are sitting right there. And if you took away like any sort of iodine in your diet, you could survive on pre-made hormones for like 3 to 4 months. I mean, so there's a lot of reserve in there. Anyway, the other really cool thing about the thyroid gland is then in these areas, these stromal areas here, there's lots of capillaries, which of course is characteristic of an endocrine organ because you want a lot of blood to be able to take the hormones away to where they need to go. Okay, this is also really cool. Look how easy these thyroid hormones are. So there's a lot of really cool things about, sorry about that. There's a lot of really cool things about having your hormone building blocks be so simple. And we talked again about the cholesterol building block for the glucocorticoids and mineralocorticoids that are made in the adrenal cortex. This again takes a different strategy, but it's just as simple. So all you need really are these tyrosine residues. And you just hook crap onto them to make your mature hormone. And the other building block you need is iodide, which then is converted to iodine, which then actually combines to these residues. So if you hook 2 of these together, if you hook like a di and a mono together, you make T3. And if you hook 2 dyes together, you make T4. And all of that just sits in the colloid. It's just so cool. So anyway, but the other thing to remember about this system, because we'll take advantage of this as pharmacologists, is that you need to have these residues iodinated to make them active. So if you don't have iodine, you can make all these tyrosine molecules that you want. You will not have active thyroid hormone. All right. So the thyroid gland controls just about everything that we do. It is like glucocorticoids in terms of supporting your body, but even kind of more so because it supports your general metabolism. So it's one of the biggies in the system. So it overall is a catabolic hormone, and I like to try to remember that because it helps me predict what somebody that has too many thyroid hormones are going to do, and also somebody that has too few thyroid hormones, what they're going to look like, because if you remember that it's catabolic. So it increases metabolism in just about all your cells. Your protein synthesis is increased, but you also break down protein because, again, you're more metabolically active. And it will also activate other endocrine systems. And for instance, one of the things that we can see in hyperthyroid cats is something called a thyroid storm. And that happens because thyroid hormone potentiates any stress hormone. So if you have a catecholamine response, having excess thyroid hormone is going to make that worse. So again, having an imbalance of your thyroid hormone is going to then affect other endocrine systems in the body. This is a picture of a hyperthyroid cat that you won't see them looking like that anymore. When I first graduated from veterinary school, hyperthyroidism had been out for, I don't know, probably 8 or 9 years, but people still didn't really know what to do with it. And we used to see a lot of cats that came in really skinny, vocalizing. They'd have dilated eyes. A lot of times they were really hypertensive. And we used to see that quite a bit when they would come in because people didn't recognize it and people weren't screening for it. Now, we see hyperthyroid cats that are presenting because we screen for it now, and it's like one of the few endocrine diseases you can screen for without clinical signs. So we screen for it in our geriatric thyroid panels, and so we're picking it up a lot earlier. So we don't see a lot of cats that look like this anymore, and this is a very, very old picture. Okay, so hyperthyroidism is one of the big diseases that you're going to be treating with the drug classes that we're going to talk about. We see this in middle to older aged cats, and the prevalence is very high. In cats over 15 years of age, greater than 50% of them are going to end up being hyperthyroid. So it is really, really, really common. And as I said before, in our geriatric blood panels, with a lot of these cats, we're picking it up really early because many people run a T4 on their blood panel, and if that's elevated, you kind of have the diagnosis. Fortunately, most of the time it's benign. There's probably about 1% or less carcinomas that are found. So most of the time it's a benign disease, and you wouldn't really care about it except that you're overproducing thyroid hormones. This happens because those thyroid glands become autonomous. They've decided they don't want to pay attention to any of their regulatory hormones like TSH, and so the thyroid cells themselves get very active, they're hypertrophied, they divide, they undergo excess mitogenesis, and they just produce a ton of hormone without any sort of regulation, and their whole endocrine axis is thrown off because they can't turn themselves off. Okay, so let's look at our cartoon, and I'm going to use the same one throughout so you don't have to get used to a different picture in terms of looking at these thyroid cells. So this is a thyroid cell cartoon, and you would do this if you were going to be a pharmacologist, knowing that you had a disease you were going to try to treat, because what you want to do is think about the processes that you could disrupt then to try to fix a disease where you're overproducing thyroid hormone. So this is your follicular cell here. Remember, we saw what it really looked like on the histopath picture. So this is your follicular cell here. This is the blood side of the follicular cell. So this is the outside of the follicular cell. This is the follicular cell that is next to the colloid, that big pink circle that we looked at in the histopath slide. So what happens when you synthesize thyroid hormone is that your bloodstream then produces iodide, which you take in from your diet, and that is concentrated in the thyroid gland. So the thyroid gland itself has a sodium iodide symporter, and it is a specific protein for the thyroid, and it sucks in your iodide because it needs that to make thyroid hormone. So iodide is actually actively transported across the cell membrane. It goes through the follicular cell down a concentration gradient. It gets oxidized here at the apical cell membrane by a thyroid peroxidase into iodine. And iodine, this is the form that allows it to couple to the tyrosine molecules that are all like stacked on this thyroglobulin molecule. So the thyroglobulin molecule, and again, I know this probably brings back memories from last year, but it's kind of this big, huge molecule, big, huge hormone that then contains these tyrosine residues throughout it that then get iodinated and combined to form your active thyroid hormones. So as I said before, this is such a cool system. The follicular cell reaches into the colloid when it needs hormone, and it will endocytose some of the colloid. It goes into vesicles that are combined with lysosomes, and then the thyroglobulin part of this molecule is actually cut off, and then these are either kept together as T4 or T3, depending if you have a mono or a diiodotyrosine, iodinated tyrosine. And then it goes into mature T3 and T4, which then gets exported right out into the bloodstream, okay? All right, so let's talk about medical therapy for hyperthyroidism in cats. The first thing we're going to talk about are thyrourine compounds. These are going to be probably the most common drug that you're going to use. They're anti-thyroid medications. They work by preventing iodine incorporation into the tyrosyl groups. So they're going to stop that iodine to get in there. There may be some prevention of coupling. They may directly interact with the thyroglobulin molecule, but the main mechanism of action is they're going to prevent the iodine from going on the tyrosine residues on the thyroglobulin, so you can make all the tyrosine you want, but if you don't have the iodine on there, it's not going to be an active hormone. So they're actually going to block this step here, okay? So there may be some effect on thyroid peroxidase, but basically they're going to stop this iodination step there so that you can't make the iodine, and then you can't iodinate those tyrosine molecules. Okay, so there are several of them that are out there, and I'm going to tell you about purple uracil or PTU. I'm only mentioning that because hyperthyroid people go on that. And when you have clients that have hyperthyroid cats, they always want to know if they can use their drugs on their cat because, of course, they get them at a reduced price a lot of times because it's on their insurance. And so they're always saying, can I use PTU on my cat? And your answer will be, no, you cannot because you will kill your cat. So there are a lot of side effects, so we don't use those in cats, even though it is something that is used in people for this very same disease. There's another drug called carbimazole. It is more prevalent in Europe, and for a while it was thought to be a better drug with less side effects. That's been pretty much disproven. So there's really no advantage to using it, although you can get it compounded. But honestly, I've never even used it. So there's really no advantage to using it. The big drug that we use is a drug called methimazole, and there is a veterinary approved product made by DECRA called Pharmacology. That is methimazole. So before Pharmacology came out, we used to have to use the human drug methimazole. Has anybody had a cat that is hyperthyroid they've had to pill? Okay. So did you use the Pharmacology or methimazole? Okay. Did your cat get to the point where they would not eat it? Oh, really? Oh, you have a great cat. Because it is so bitter. I don't know if you've ever, not quite gotten it in your cat and had some of it, on the cream cheese that might be on your hand and went, oh, it tastes really bitter. It is really, really bitter. So it is a very bitter drug. And so a lot of times when people have used generic methimazole, they've had a hard time getting it down their cats because it's very bitter if the cat doesn't eat it right away, or you can't get it down right away. The other problem with the human generic methimazole is that when the owners often have to break the pills because they come in 5 milligrams, and we usually don't give that much, and then they get the powder all over their hands. So if they do stupid things like eat food without washing their hands, not that anyone would do that, but let's say you did do that, then you could actually ingest this stuff. But anyway, there is a veterinary approved product called Pharmacology. The other advantage to this drug is that they are very brightly colored pills, and that's really nice because it's easy to spot when your cat spits it out. They come in 2.5 milligram and 5 milligram tablet size. The advantage to methimazole is that it's a very inexpensive, so it's a pretty cheap drug, and if the owners have a hyperthyroid cat and they're not quite sure if they want to really, if they don't have a lot of money or they're not really sure that, they really want to treat the cat, this is a kind of cheap way to get them going, to see what treating the cat is like. And a lot of times we can get them on methimazole. They start to like the cat again because hyperthyroid cats can be really annoying, and they start to like the cat again, then they might think about another alternative that's more permanent if they want to. So that's one advantage. The other advantage is that if you have a cat that's in renal failure or, chronic kidney disease, we know that taking away thyroid hormones actually makes that worse, or makes the numbers worse, not the disease worse, but the numbers worse because you decrease your GFR. And so very often if you're using a drug like this, one of the advantages in a CKD cat of using a drug is that you can kind of titrate how much thyroid hormone you're going to control. The other way that we use this drug is to stabilize them if they're going to go to surgery. The disadvantages are that you have to pill these cats usually twice a day, which is a pain in the neck for many owners. Doing twice a day meds is hard anyway, and trying to pill a cat sometimes can be a challenge. And as I said before, when this drug, if you give it in food and the drug starts to melt it all, it's really bitter. The other problem with this drug is the side effects to it. It's a very immunogenic drug. Now, usually you're going to see the side effects right away, so you'll be able to identify that, but in the papers that have been published about this, they can occur up to 3 months after you start the drug. I've also seen this happen when people have changed the dose, so they may increase the dose, and all of a sudden the animal will have a side reaction to it. The GI side effects are usually transient, and that occurs reasonably commonly. Probably 15% of the cats will get that. So they'll decide they want to vomit, or they'll decide they don't want to eat. And if you hang in there with the drug, they usually get over that pretty quickly. The ones that you can ignore are when they have really an immune-mediated reaction to the drug. And there's a couple of ways that can manifest itself. One is with facial excoriations. And the cats just literally, they scratch their face and they will honestly scratch the skin off their face. It's really disgusting. And that's a side effect of methimazole. The other thing is hepatic toxicity. Now, again, these will resolve if you stop the drug, but you probably can't use it because the animal just can't tolerate that drug. We also can see immune-mediated problems. These are much less common. You can see an IMHA, you can see an immune-mediated leukopenia, you can see a thrombocytopenia, and they can have a positive ANA, which is basically just an anti-nuclear antigen that you produce, and what that tells me is that there's a systemic immune-mediated response against yourself. As I said before, methimazole is a very immunogenic drug. Again, these will usually resolve after you stop the methimazole, but if you decide, and this is a great case example of a cat that I saw years ago, and it had an immune-mediated leukopenia, which isn't very common at all. The referring veterinarian decided then to put it on half the dose of methimazole rather than the full dose, and actually the cat's bone marrow was absolutely wiped out. And we actually couldn't do anything for it. So be careful about using it even at a lower dose if they have a really bad response to it. These are rare. Oh wait, whoops, I think I said that here. So if you see any of the immune-mediated side effects, you need to stop the drug, and don't try to use a smaller dose. As I said, you can cause more of a problem. There is no reason not to use this drug. It is a really good drug. I use it a lot. My own personal cat is on methimazole. There's not a reason to use it. Just be aware of the side effects. And again, if you have an immune-mediated type side effect, you probably can't use this drug. So how does this come? It comes in a pill. Again, we have Fluimazole that's a veterinary approved product. The only problem with Fluimazole is it comes, the lowest dose is 2.5 milligrams. You cannot cut those tablets, so because they're coated, so you can't cut them. So if you have a cat that has to go in 1.25 milligrams, you have to use the human version. And you can buy the brand version Tapazole, but you don't need to do that. The generic methimazole is fine. You can get it compounded into a liquid. There are issues with that. If that's the only thing a cat will tolerate, then that's what you get to use, but realize it may be less potent and it may expire more quickly. And make sure your compounder kind of knows what they're doing. The other way that you can use this is actually as a transdermal, and this is one of the few transdermals that actually works. So then you'll put this on the ear, and usually people use the ears in a cat because it will absorb easily rather than trying to get it on the gums or something like that. So you can rub it onto the ear. It's made in a PLO ointment, and you have to get it compounded at a pharmacy. There's no manufactured form of this, which is absolutely a sin. So there was a company, and we did the clinical trial here a couple of years ago, that came out with a once-a-day methimazole that was transdermal, that would be then, made made the same. That's the nice thing about getting something that's manufactured, is that it's all sort of synthesized the same, so you can kind of trust the concentration and everything. And it was a beautiful product. It worked really well. And they could never get it through the FDA. You want to know why? Because it was a transdermal. And the FDA said people are going to get it on their skin, they're not going to wash their hands, and they're going to end up getting hypothyroid from it. And so it was like a nightmare to get through, and it wasn't worth the money to try to get it through the FDA because of that. So hopefully at some point someone will come out with this once a day, because I think it would be really helpful for many, many, many cats. With the transdermal, it's probably less efficacious, so you may have to use a higher dose than what you think you would use. There are less GI side effects, but the same immune-mediated side effects. So, for instance, if you had a cat that had facial excoriations as a result of getting oral methimazole, the transdermal will do the same thing. So treatment regime, if you have normal renal function, I usually start them at 2.5 milligrams twice a day. Some people do 5 milligrams twice a day. That's quite a bit. So I think most people would probably agree on 2.5 milligrams twice a day. And then if you have renal insufficiency or failure, then think about 1.25 milligrams twice a day. You want to monitor these guys in 1 to 2 weeks and make dose adjustments based on your T4 that you're going to measure. It is helpful, although a lot of people won't do this, but if you can get a CBC as well to look for any of the IMHAs or the leukopenias or thrombocytopenias that you might see, that is helpful. So I like to do a blood check on them just to make sure that they're okay and I'm not getting into any trouble with them with an immune-mediated side effect. But most of the time, people just measure T4 on them. Yeah?
For like long-term use, obviously they're going to be hyperthyroid, or if they're on methimazole, you said it's hepatotoxic as well, would you recommend checking liver values like twice a year, once a year?
Yeah, that's a good thought. You probably should check their liver values as well. Usually you will find out that they have a liver problem because they get sick, but it's always good to be proactive about it. We usually check these guys every 6 months. I like to see them, even if they're stable, I like to see them every 6 months and run blood work on them just to make sure everything's okay. Yeah?
During that first 1 to 2 week monitoring period, how often are you checking like the T4 or CBC?
Yeah, so I get them back in like 2 weeks and I'll do a CBC and a T4, and depending on what that looks like, if I have to make a dose change, I'll get them back in another 2 weeks and just check the T4. And then if that looks okay and I think I have them on the right dose, I usually try to get them back in a month later, recheck a CBC and a T4, and doing a liver profile never hurts either. It depends how much. If the owner said, I don't care how much money you spend, I want my cat to have the best care, I would check probably every month for like 3 months, and I do a chem profile and a CBC. Okay, so methimazole, that's one category that you have. Another category of therapy that you have isn't really a drug, but it kind of is because it behaves like one. And this is YD food. So the idea behind this is that it's a very low iodine. And in fact, I didn't realize this, but apparently you cannot make a food that has no iodine in it. Like there's no way to make that, at least according to Hills when they presented this data. But this is a very low iodine content. And the idea is, okay, if you're going to be hyperthyroid, we're going to treat this by just not giving you any iodine. You can only get it through your diet. So if we stop the iodine in your diet, then you can't make active hormone and we can control this disease. So the place where this works is here. You're going to block this because you're not going to give them anything. So you're just going to block the hormone production from the beginning. I didn't do an advantages, disadvantages. That was dumb of me. So advantages are, this would be something that you would try if the animal can't tolerate methimazole, and surgery or I-131 are not options. So YD is something that you can try. It used to be if people have a multi-cat household, you can also feed it to normal cats, and they seem to be okay with it. It was studied for 3 years in normal cats by Hills, and they were fine. So I don't really get that, but they were. So apparently they can. I think cats don't need very much thyroid hormone because, you know, you do surgery on these guys and you think you've wiped out the thyroids and they're fine. So I don't know, they must need like 1 cell. But anyway, these, and I'm thinking with my cats, yeah, they probably only have 1 cell. But you can feed this to normal cats if you need to. The rule used to be that you had to give the normal cats like a little bit of regular food to make sure they got enough iodine, but apparently they will get enough if they eat this, at least according to Hills and other people that I know that have fed this to normal cats. So it doesn't have to be a single cat household. It is this, the disadvantages to this diet are it's expensive. A lot of cats don't like it and they won't eat it. And the cat absolutely can't get any other iodine sources. So if they eat bugs in the house, you're done. If they go outside and eat stuff, you're done. You can't use it. So they really have to they have to just get this food. So that's one of the limitations that I've seen happen with these cats. But other than that, there was a really nice study that came out of California where they looked at a whole bunch of cats that were on YD, because I was kind of skeptical about this. I didn't have very good luck with it, but this study really showed good success. So this is definitely something that you can try for those cats in which you can't give them methimazole and you don't have any other options. Yeah.
Would you ever recommend using that in conjunction with methimazole?
Yeah, so the question is, do you need to use it with methimazole? And the answer is no. There's no reason to. It's expensive, and you could feed them normal food and still give them methimazole. All right, so this is another option that we have is surgery. You will not see that done here because it's more expensive to do that than just to do I-131 here. But in practice, this is a great option. So there's either not a radioiodine facility near you or the owners can't pay for it, and so you can do surgery. The problem is, what happens if you take out 2 thyroids all at the same time? What else is in there? Parathyroids. And then what happens if you remove the parathyroids or disrupt their blood supply? You get hypocalcemic. So that is a big problem with this. However, you can just do one side at a time. So if they're hyperthyroid, you know it's probably going to be bilateral. You'll probably have to do both sides, but you can do one side, let them recover from that, keep measuring their T4s, and when they go up again, do the other side. So that prevents you from making them hypocalcemic. Obviously, that's going to work here because you're going to take the whole cell out. Okay. The treatment of choice for hyperthyroidism in cats is radioactive iodine, because it's very effective and it is a one treatment solves the problem type thing. So what happens here is that you're going to give a radioactive iodine compound, and that is going to be taken up through this iodine symporter, that is going to concentrate the radioactivity into the most active cells because they're the ones pumping the iodine in. And so the radioactive iodine that we can use is I-131. It is a beta emitter, so it doesn't have a long range. So it's just going to kill that cell that it gets into. And basically you just kill this, you irradiate the cells. The other nice thing about radioactive iodine is it's got a very short half-life. And so you can actually hospitalize these cats for the time period until they clear the radioactive iodine. So the half-life is 8 days. I said all that other stuff. And one cutaneous injection is curative for about 95% of cats. That percentage is probably a little bit lower. This is an old study, and we're seeing a lot of cats that were treated when they were maybe 8 or 9, and they're coming back in for retreatment when they're 16 and 17. So it's probably a little bit lower, but over 90% of cats are cured with one subcutaneous injection. There's no side effects. It's not invasive. If they have ectopic thyroid tissue, which is reasonably common in cats, you will get that as well. So ectopic tissue, a lot of times they have it in the mediastinum, and you will get that as well. And if you use higher doses, if you do have that rare carcinoma, it will kill the carcinoma cells as well. Disadvantages are the cost and hospitalization. At the University of Georgia, we hospitalize them until they have they have to reach a certain baseline level for the radioactivity they're emitting before they can go home. There are some commercial ventures that do this, and I think their clear time is like 3 days, but they have to go in the hospital for that time period. And also, if you use RadioCat or one of the commercial entities, they can't have any other diseases. So if you have a diabetic or anything like that, they can't get treated with RadioCat. The cost is an issue. It's probably about $1,500 to $2,000. You break even with a hyperthyroid cat after about 2.5 years, money-wise, with monitoring and drugs and everything. And then the other issue with this is it may precipitate renal failure. Hopefully, most of the radioiodine facilities have gotten smart about doing this, so they're actually doing scintigraphy before they give the radioactive iodine. We're dosing them lower so we don't put them into CKD. And hopefully they don't become hypothyroid, but that's always a risk factor. And I'm going to put the dose up here. You don't have to remember that. Unless you work at a radioiodine facility, you're never going to need to know this. So I'll just skip right ahead. This is the first cat that was treated at, this is a very old picture, and this cat was actually in Cat Fancy. The owner was so excited that her cat was in Cat Fancy. But this is the first cat, Sasha, that I treated when I started the radioiodine facility at the University of Pennsylvania many, 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 many years ago. And you can see that this is skinny Sasha, who was hyperthyroid, and this is fat Sasha after we fixed him. It's like he comes in, they're so funny when they come back in, like he came back in, it's like, oh my gosh, he ate another cat. He's like huge. Okay, so we've talked about hyperthyroidism and the drugs that you have to use. Yeah.
Sorry,
No.
I wanted to ask about like the prevalence of the iodine treatment, because when I had, it was a couple years ago when I had my thyroid cat, and I was told that wasn't an option.
Really?
She didn't have renal disease or anything,
Huh.
just hyperthyroidism. I don't know if my personal vet was like not familiar, not comfortable with referral or anything like that, but is it like more prevalent now?
So the question is, how prevalent is radioactive iodine? So I'm going to give you my read on that. It has been around for a long time. I mean, I was at the University of Pennsylvania, 20 years ago, and you know, we had a huge facility there. So I probably started that facility like 25 years ago, and we were not the first ones. It is not available all over the place. So sometimes there aren't facilities that are close by that you can get to. Most universities have them. There's a company called RadioCat and ThyroCat, and they have facilities that they set up around the country to do that. And so it might have been that your veterinarian wasn't familiar with it. I think radioactive iodine is the way to go, and that's even with, and I use one of these cases when I talk about this to referring veterinarians, like for CE conferences. I actually just spoke on this at Western a week or so ago, and one of the cases I presented was a cat that actually had stage 2 CKD, and I happily treated that cat with radioactive iodine because the owners couldn't pill it. I mean, they just couldn't get the medication on it. They couldn't do they couldn't do anything. And so, so either you leave the animal hyperthyroid or you use radioactive iodine. We use radioactive iodine, and that cat was fine, because my theory in that is that you can treat CKD, we can manage it, right? But hyperthyroidism will kill that cat. So, and the cat did fine. So I think his creatinine was about 2.4 when we started, and ended up being like 2.7, and he did great. So I'm a total believer in radioactive iodine. And so then you're probably saying to yourself, oh, but you said you gave your cat methimazole. Like, why didn't you have radioactive iodine done? Well, that is because I am a really bad owner, and you want to know the reason why? Because this cat, my cat, is my beloved. He's just the coolest cat. So he came with us from Philadelphia. He's grown up with my kids, and like all their friends know him. He's 20, he's almost 21 now. And honestly, I didn't want him to be away from home for 5 days. Sad, but true. That is the truth. So I was like, and you know what, you can't even guarantee 5 days here. Sometimes they get persnickety, and then radiology says they have to stay like a week, and I was like, I'll just give him a pill. So that's my bad. That is my bad. So now I understand those owners that are like, I don't want to leave him. And you're thinking to yourself, oh, just leave the damn cat. And now I was one of those ones. And you want to know the really bad thing is you can't tell anybody. Like, I couldn't tell anybody because all my friends here, like Dr. Bugby and all the nurses, were like, just give him radioactive iodine. I'm like, no, I don't want to leave him. So, sad but true. All right, flip side of this disease. So we talked about hyperthyroidism. What's going to happen when we're hypothyroid, right? Okay, so now we have thyroids that don't make anything. This is easy, right? What are we going to do? We're going to supplement them. Yeah, very easy. So hypothyroidism is common in middle to older age dogs. It is the most overdiagnosed disease that there is. We have a lot of normal dogs that have been diagnosed as being hypothyroid, and they've been on thyroid med their entire life. Fortunately, dogs and cats metabolize thyroid hormone really quickly, so we get away with over supplementing them, and they usually don't get hyperthyroid. But it is the natural disease actually is relatively common in middle to older age dogs. The prevalence is like 2.2% of the whole population. So that's a pretty high prevalence. We do see it in cats. It's pretty uncommon, but we see it periodically. You can see it adult onset, and you can also see congenital hypothyroidism in cats. It is seen in horses, and we've seen it in birds. And in fact, I was part of diagnosing the first bird that ever got it years ago when I was at the University of Pennsylvania. I used to hang out with the exotics people because they were really fun. And they had clinics the same time we did, so when I got bored with like our stuff, I'd go hang out with them. And they had this bird who kept falling off the perch. And so we were chit-chatting about it, and I was like, you know, if that was a dog, I'd say it was hypothyroid. And I'll be damned if that cat was, or that bird wasn't hypothyroid. So it was really interesting, very cool case. All right, so what happens in the natural disease? You get an immune destruction of the thyroid gland. So we think it's immune mediated. You can find anti-thyroglobulin antibodies like you can in people that are hypothyroid. We can find those in dogs. If we look at the thyroid gland, there's usually an infiltration of lymphocytic and plasmacytic cells. So it tells you it's probably immune mediated. And when you wreck the cells, you can't secrete hormone. So pretty straightforward. So this is what happens is you don't have any of these cells because you destroyed them, and so we're going to supplement them. Okay, if you have an emergency, which happens, this was a really cool case, and I didn't teach you guys physiology, so I didn't tell you about this case last year. This was a dog named Ebony. It was a 2-year-old Labrador Retriever who came in years ago, and came in, and it was clearly a myxedema coma. So they get myxedema when they're very hypothyroid. They get all kind of puffy, and they're very depressed. Heart rate's usually really low. They get cold, like it's an emergency situation. But it was so, we don't see it very often. So it came in, everyone's really excited. Oh, well, let's go get Ward. And so we're down, and I'm like, this is a teaching moment. And so we're talking about this case and everything, and finally one of the students goes, do you think we should treat this dog? And I'm like, oh my God, yes. Yes, we should treat this dog before it dies. So we did, and his name was Ebony, and he did great. But anyway, if you need to use IV levothyroxine, you can. It is probably not going to be on your practice shelf. We had to get it from a human hospital, but you can use it. It is available. It's reasonably expensive. But there is a dose that's available, and you can use it if you need to. And the dose will be in every emergency book that will be in any practice that you have. So you will get it there. I forget what it is, but it's like a quarter of the oral dose, and you just give it IV. What most people have done, because this is not available, you don't have IV stuff available, you can actually dissolve up the tablets, and you can give them rectally. They will absorb it through the rectal mucosa. So if you have to, you can do that. But it'll be really rare if you see these. Most of the time you're going to diagnose a very stable animal, and you're going to supplement them, and it just could not be easier. The treatment of choice, you have one treatment out there. Sodium levothyroxine is the only thing that is out on the market now for dogs. The people that make it, I don't know, somehow got everybody else to have to take theirs off the market. It is FDA approved. And they color code the tablets. They put the weight on the back of it. So there really is nothing in terms of treating this. It's very easy to treat. You can use Synthroid, which is the human form. It is going to be more expensive, and actually it's less potent than the veterinary form. So veterinary form is what I would just stick with. The other thing so there's a couple of caveats, and I don't know if I put this in here. Okay. I put the dose up here for you, but again, it's not really something that you need to remember because it's going to be on the bottle. But there are a couple of dosing things that I want to make you aware of. One is that if you have a hypothyroid person, they may question this dose because they will be getting 1/10 of the amount that the dog will. Okay? So dogs need more, which is why we're able to supplement so many more dogs, so many normal dogs, because they metabolize this so quickly. The starting dose on this is twice a day. That's usually what I start them out when they're really ill. Many times these guys can be managed chronically on once a day. So once you get them stabilized on twice a day, give them a good 6 weeks so that stuff resolves. You can try once a day therapy, and many of them will be fine with once-a-day therapy. If they're severely debilitated, you may want to start them on half the normal dose for a couple of weeks and then work them up. I've never really had to do that, but you can if you need to. Okay, so that is what I had for you today. Are there any questions I can answer for you? Okay, so tomorrow I'm supposed to talk to you about like calcium metabolism and parathyroid diseases, and we'll talk about some of the drugs that you use to really work with hypercalcemia. That's what we're going to talk about, but I'll do some cases as well, since there's not a whole lot that we have to talk to about with that. All right, and I will get to see you tomorrow. Go outside. It's so nice. Damn. Yeah.
So I've been dealing with my 11-year-old cat, and so she's hyperthyroid and has kidney disease.
Oh, yay!
And so I was wondering, she's been on methimazole, and at first she was on the 5 milligram, and that masked her kidney disease.
Yep.
So now we had her on 2.5 not long ago. But she got really bad like side effects, and it was interesting because she's been itching, and I was like, "Why are you itching?" Like, but now I think
It's
that's
the
probably why.
methimazole. Shoot.
And so now we're trying. I'm actually getting a shipment today for the transdermal for less side effects. But I was wondering, since you said you probably break even with the radioactive iodine.
I will be shocked if she doesn't get the same problem with transdermal. She probably will. She'll probably still itch. And the radioactive iodine, I would really look into that. Honestly, I should have done that with my cat. I was just such a weenie.
Yeah, when they told me, I was like, I
I don't want to leave him. And yeah, what a stupid thing. I know better than that. And I could even visit him. It was just like I just didn't want to do it because he's so old. And, but I would look into that. The other thing is you will get a discount here as a student, so that will help as well.
Okay. So I had Dr. Gross.
Oh my gosh, great.
So she told me that the iodine, the radioactive iodine, they were like not up.
Oh, really? Still?
Yeah. Since COVID.
No.
But she said that they're trying to get it up within the next couple months. So
I would email her and ask her about that and tell her you really want to do this with your cat. And see what she says and see when that's coming back up. I knew they had stopped it because of COVID and because the hospital has just been so overwhelmingly busy. And I left, and so they didn't. It was really hard for them to run it, but. Ask her and see. Just say, you know, that your cat's having a methimazole reaction, and you don't know, like you really need to get I-131. We did it for another student, even through COVID.
Really?
Yeah,
Okay.
yeah.
Okay. Well, that's good to know because, well, I guess she's like a little older, so I was like, is it worth it?
Oh, definitely worth it. Definitely worth it. You said she's what, 11?
I think she's 12, but she's like, I feel like they probably like did it wrong because she looks way older. So, I don't know.
I would, if my cat had had a methimazole reaction, I would have bit the bullet and made him stay in the hospital for 5 days anyway, so, yeah.
Okay, well because it's just been like bill after bill with T4s and like,
Yeah, and I would just email Dr. Gross because she'll know exactly what's going on. She's great, and she'll know kind of where they are with the I-131 and maybe push them to start getting it up and running again. Yeah.
All right, sounds good. Thank you so much.
Yeah.
Practice too, or just teaching?
I'm sorry?
Are you retired from practice too, or just teaching?
I'm just teaching. No, I retired from the university, so I'm doing some consulting with some pharmaceutical companies, so I'm still doing case consultations and things like that. But yeah, I'm not doing the diabetes clinic or anything like that anymore, unfortunately. I miss that a lot.
Yeah, I'm sure.
I do. I like doing the case consultations, but I do miss the practice part of it.
Yeah.
So
That's cool.
That's all right. I got my own cat, right?
Yeah.
That I won't treat
Hospital.
that I won't treat appropriately.
I'll be home with you. So
That's
good.
right.